There's a condition where it's called a compression fracture of the vertebrae. It's a very, very common condition. It's a condition where billions of dollars are spent each year for loss of productivity, hospital expense, and so forth. It happens much more frequently than wrist or hip fractures, which a lot of people don't know. It is usually in elderly women, postmenopausal women, that have very brittle bones, very soft bones, and they've fallen. A lot of times you see the patient coming into your office and they have a hunchback from their osteoporosis and so forth. They fall and basically, very simplistically, what happens is the vertebrae collapses down on itself. The treatment for a compression fracture depends on the severity of the fracture, how symptomatic the person is. But it could be something as simple as anti-inflammatories or pain medicines to wearing a brace, or if very severe, or if that person has failed the first two, then you can proceed and do what's called a kyphoplasty. A kyphoplasty procedure is a procedure that many times is done with sedation and local anesthesia. General anesthesia is not required. The procedure, if it's one level, is very quick. It takes 20 minutes, 30 minutes to do. What we do is you put a needle, you guide a needle down through a part of the spine called the pedicle. You guide a needle down into the broken bone, the collapsed bone, the compressed bone, and you open up a balloon, you dilate a balloon, with the idea that if you have the vertebrae compressed down, the balloon will push that back up, kind of like a hydraulic, if you will. You create a cavity, the balloon is deflated, cement, it is cement, which hardens very quickly, is injected into that cavity so the bone hardens and that fracture line is hardened, solidified immediately.